ahead and call to order the meeting of the Durham County Board of Health for February 11th, 2021. Before we get into the agenda, specifically the discussion and approval of today's agenda, I'd like for us to take just a moment of silence in remembrance of Dr. Robert Rosenstein, if you would, please. Thank you. I just wanted to say it was indeed a pleasure to serve and work with Dr. Rosenstein on the Board of Health. He was always engaging, always full of knowledge, willing to share his knowledge, and had what I thought was the greatest sense of humor. He will surely be missed by this board. Thank you.
Absolutely.
Item number 2 on the agenda is the discussion and approval of today's agenda relative to any adjustments to the agenda. Do I hear of any adjustments to today's agenda? Hearing none, I'd like to call for a motion to approve the agenda. It has been so moved. And do I hear a second?
Second, Jim Miller.
Very good. It's been moved and seconded. Now we'll do a roll call vote relative to the approval. Ms. Ross?
Mr. Allen?
Yes.
Dr. Jackson? Dr. Jackson?
I have to unmute. Yes.
Dr. Miller?
Yes.
Dr. McDougall? I don't think he's here yet. Mr. Curtis?
Yes.
Dr. Braithwaite?
Yes.
Mrs. Orto?
Yes.
Mr. Brown?
Yes.
And Commissioner Alam?
Yes.
Thank you.
Thank you. Item number 3, review of the minutes from our prior meeting of December 10th, 2020. Are there any adjustments to those minutes? Hearing none, I entertain a motion to approve the December 10th, 2020 minutes.
Vince Curtis, motion to approve.
Is there a second?
Seconded.
It's been moved and properly seconded to approve the minutes from the December 10th, 2020 meeting. Roll call vote, please.
Mr. Allen?
Yes.
Dr. Jackson?
Yes.
Dr. Miller?
Yes.
Dr. McDougall? Mr. Curtis?
Yes.
Dr. Braithwaite?
Yes.
Mrs. Orto?
Yes.
Mr. Brown?
Yes.
Commissioner Alam?
Yes.
Thank you.
Thank you. Ms. Ross, do we have any public comments? Anyone signed up for public comments?
No, sir.
Thank you. Item number 5, staff and program recognitions. Rodney, Mr. Director, do we have any?
Thank you, Mr. Chair. None in particular, and good evening to the members of the board. I just want to take a point of personal privilege just to, again, commend the staff for the hard work that they've done as far as pivoting toward COVID vaccinations. We have a mass vaccination clinic that's going strong. And just to keep, just to kind of put things in perspective, which I know this great board knows, we have been doing COVID testing and surveillance for some year now. And now comes the Herculean effort to vaccinate. And it's been some very, very long, trying days, but the staff has been doing a fantastic job. They've been getting a lot of positive comments from the community, and I just wanted to take an opportunity to really praise them and thank them sincerely for all their hard work.
Thank you, sir. And we in turn would like to do the same. It's been definitely obvious the hard work that your staff has put in over these past few months, and we're so thankful for you for that effort.
Yeah, absolutely. I want to comment too and thank you. I actually got my first shot at the health department, I guess a couple of weeks ago on a Saturday. That setup and operation was very impressive. When I first walked in, there were so many people and the line was so long. I was like, oh man. But by the time I was done, it was pretty much cleared out. I was only there an hour. It was amazing. So kudos to the staff, Roddy and your staff.
Thank you so much.
Outstanding.
They're doing a wonderful job. I get my second shot at the health department next week, and it wasn't a wait at all. I think we were gone in half an hour, 45 minutes.
Yeah, I was only there an hour because I had to sit for 30 minutes afterwards.
Very good. Outstanding. At this time, I would like to recognize our new member, our commissioner representative, Commissioner Alam. Welcome to the Durham County Board of Health. We look forward to a long and fruitful relationship with you, moving public health forward in Durham County.
Thank you. Thank you so much. Thank you for all you guys have been doing for this amazing vaccine rollout. I know me and Dr. Jenkins have definitely talked about like the burnout that exists around dealing with the pandemic, and you guys have been really strong in continuing to keep up the fight to make sure we're keeping Durham healthy. So thank you so much.
Thank you. Thank you. All righty. Item number 6, administrative reports. We have a report on the state of food security in Durham from Kelly Warnock. And board, if you would refer to your packets for the presentation, we greatly appreciate that.
All right, thank you, Eric. Can you all hear me okay?
Yes.
All right, let me get my screen shared. Get this up. I cannot share my screen, I guess. So I'll just speak, but y'all have the presentation in front of you. Rosalind, if you are able to share the presentation, that would be fantastic. But the first slide just goes over the statistics, a bit about statistics of food insecurity in Durham, both before COVID-19 hit and then after. So we were in public health and throughout different nonprofits in Durham, we were very concerned about food insecurity prior to COVID-19 in Durham. The Food Bank of Central and Eastern North Carolina reported 16.
Hey, Kelly?
Yep.
I'm sorry to interrupt you, but we just made you the host, so you should be able to.
Awesome. All right.
Thank you.
Yay.
Thank you. All right, can y'all see that now?
Mm-hmm.
All right. So like I was saying, before the pandemic hit, the Food Bank of Central and Eastern North Carolina reported 16.5% of Durham residents were food insecure. And then when we did our 2019 Durham Community Health Assessment, or health survey, 20.9% of the Latinx and Hispanic population responded that they had skipped or limited their meals. This is much above the North Carolina and the average in North Carolina and the United States. We also know 64% of Durham Public Schools participated in the free and reduced lunch program last year. We don't know the current rates since they did not have to fill out that form this year. So now Feeding America, which provides food to Central and Eastern North Carolina, estimates that about 20% of Durham County residents are food insecure. And this is much higher among Black and Brown residents, households led by single moms, and children. They're reporting that actually 1 out of 4, 25% of children are food insecure. That equates to about 55,000 people, just over 8,000 seniors, and 16,580 children. So that's a good part of Durham that don't always know where their next meal is going to come from. Individual food pantries we've been working with have reported a 50 to 500% increase. There have been a few food pantries that went from serving about 50 people to now serving over 500 a week. And so I'm not sure that this 20% number is actually showing the full scope of the increase. The most vulnerable populations are those that have also been hit by the COVID pandemic the hardest. So seniors and people with COVID vulnerable populations, those with underlying health issues, have always been more at risk of food insecurity. Black, African American, and Latino households, households that include undocumented residents because they don't necessarily want to apply for the different federal food programs, households that are isolated due to a positive test or exposure have been hit pretty hard with food insecurity, both because they can't get that food while they're in isolation and also due to loss of work while they were in isolation. Families with children, because those children are not in school and getting those meals when they're in school. And then people with transportation and access limitations. When the buses reduced their hours of operation and the number of people who could go on the bus at a time, it really was hard for people to get groceries that were that relied on the public transportation. So what was our response in Durham? Back in late March, early April, the Emergency Operations Center in Durham formed a COVID-19 food security task force. At the time, I was one of the co-chairs of that task force. I've paused that work to now work on the vaccine clinics, but I'm still in communication with the other co-chairs. And that we went this route because in Durham, we have so many amazing nonprofits that already are working towards in the food security realm that we didn't want to reinvent the wheel. So we wanted to bring all those different groups together instead of starting our own work. So we convened over 40 partners on a bi-weekly basis. Back in April and May and June, it was weekly, and there were over 80 partners typically in each of those meetings. In those meetings, we share resources, information, we find out what the needs are in the community, and then we try to fill those needs. We partnered with the Triangle Nonprofit and Volunteer Leadership Center to create a volunteer portal because many of the seniors who had been the volunteers at those food pantries were no longer able to get out safely. And so we were able to fill those needs. We assisted partners with safety, both COVID and also traffic safety, because the food pantries had to turn into drive-throughs. Logistics, supplies, we passed out thousands of masks. We also helped different pantries access more food when they need it. We're continuing to survey partners on a regular basis to keep a pulse on the food security and the food pantry data to find out numbers and see what the trends are in Durham. And we've begun to switch our conversations a bit to talk about how we can move from this emergency food system that has existed in Durham to that's more of a charity model to a food justice model. So how do we build our system so that we are supporting those who are most in need or most at risk of food insecurity? How do we make them independent as far as getting jobs and living wages and issues like that? Other things that we've done is we've worked really hard to provide clear information about the federal nutrition programs. Emergency food, such as food pantries, provides only a very small percentage of the food relief that goes out there. The majority is actually provided by the USDA programs, including SNAP and WIC, and also Pandemic EBT is a new program that started last spring. So we created fact sheets. We wrote things in low literacy levels in Spanish. We used clear graphics that weren't, that we know, we used wording that our population typically uses and our Durham residents, so that it was just much more clear than the fact sheets that were put out at the federal level. And we spread this through social media, through our partners. Durham Public Schools has been amazing, letting us provide robocalls to the different families, and also posting information on their website. Speaking of Durham Public Schools, they have been one of the major players in providing food to families with children. They have been providing breakfast and lunches for all children ages 1 through 18 at many sites throughout the community. They drive around in buses to different neighborhoods. They're providing it at some schools and at different community sites. There's their website, and you can go on to see their schedule, which does get updated often. Some of the sites are providing multiple days of frozen meals at a time, and some are providing hot meals that you can go through and get a hot lunch and then a frozen breakfast for that next day. There is often some extra food thrown in there to eat over the weekend. They're providing fresh fruits and vegetables through the Fresh Fruits and Vegetable Program. And currently they're serving about 6,533 children per day. So far fewer than they would during the school year. So we know that there is a gap. They're also, Eat-N-See is a nonprofit that started up because of the pandemic, and they are organizing volunteers and are actually delivering 2,000 of those meals, or 2,000 to 2,000 children, or 20,000 meals weekly. And so to sign up to volunteer or to receive meals, it's eatnorthcarolina.org, I believe. And then we are actually funding them. We're providing them some funding for the staff time to manage all those volunteers. We are also funding Eat-N-See to provide meals to families that need extra food. So this is a referral only program. It started last fall, and we've just renewed some of the funding. The meals are, they're working with BU Cafe and some other Black, Brown, and women-owned restaurants that to provide meals to about 200 families, or 888 people, and then also 135 seniors, which is 405 meals per week for the seniors. It's three meals a week. And then on top of that, they've worked with some different organizations to get 178 pantry item boxes donated that they're providing to those families. And there is some room for that program. So I'm happy to answer questions about how to refer. We have a room, as of last week, there were spaces for 15 more seniors and about 50 more families to get those meals. We're also funding End Hunger. Well, we did fund last spring to fall, End Hunger Durham, El Centro, and Meals on Wheels to provide meals to the senior and Latino households throughout last fall. And then this past month or two, we renewed started five nonprofit grants. So the county nonprofit grants for food insecurity are going to be going to Believers United for Progress, which is a food pantry on Fayetteville Street. Communities in Partnership, which is a co-op in Northeast Central Durham. Durham Congregations in Action, which is the fiscal sponsor, for End Hunger Durham. And also they're going to be providing mini grants to hunger agencies. So it's really hard for a lot of food pantries to just get small grants to buy things like refrigeration and shelving. And with that increase in their clients, they really need just some basic supplies. And so that's going to be the purpose of those mini grants. Iglesia Presbyteria Emmanuel is that food pantry that went from 50 people a week to 500. And so that's just going to be food for that food pantry. And then End Hunger Durham is going to continue their work with seniors. We've also worked with United Way of the Greater Triangle, and then the Durham Chamber of Commerce in the city of Durham. And we're going to partner with them to create a Durham One Fund that's specific for food. And the money could go to hunger relief agencies and nonprofits. So hopefully that we're working with the county legal and making sure there's an MOU set up so we can continue this into the future. We want to just build a really good base. One thing my team helped with at the health department, the Durham County Dine team, and also the city of Durham, their GIS, and End Hunger Durham, was they created an amazing resource with a food map that's housed on the End Hunger Durham website. But it can also be embedded in any website. And it links all of the no-cost kid meal sites, so the Durham Public Schools and other sites, the farmers markets that have double bucks, food pantries, just all sorts of, it's a searchable map. So you can type in an address and find something that's close to you and find out all the information about it. And that gets updated at least once a week. So it's really accurate. We also, between April and October, provided food deliveries for people who were testing positive. This was done by Durham County Department of Public Health staff. We would go to Food Lion and use gift cards, and we bought groceries and supplies for people who just didn't have another way to get to obtain food and supplies. They didn't have the social or the financial support. We served 1,049 individuals during that period. The average cost was about $5 per day per person. And we would provide them with 7 days worth of food so that they could stay in their house during that isolation period. We are now referring to the Duke Social Support Program that's doing something very similar, using nonprofits to do that. We are talking to Cure Americas about contracting with them to provide support to households in emergent need. So that Duke program doesn't, they have up to 72 hours to be able to provide that food. And there are some families that just don't, they need something before then. And that program, the Duke program, is also only going to go through March, I believe. That's what we have confirmation of. So we just want to make sure we have a backup in place when that program ends, when the Duke Social Support Program ends. And finally, Durham County, the DINE program that helped create that map, it's a SNAP Ed program. So it's provided by the SNAP or food stamp program. And we have worked for years to try to increase access to healthy food throughout Durham County. So we work with partner agencies to make policy systems and environmental changes. And we have continued to do this during the pandemic. We are partnering with 5 different food pantries, helping them everything from buying equipment, writing small grants to buy new equipment, to getting them in touch with different community partners, to providing them with healthy recipes to put in their box. So whatever they need, we will help them get. We've provided signage for some traffic. There were some concerns that some of the pantries had such traffic issues with the drive-throughs. And so we worked with the city and the county to help with that. We've also worked with Head Start, Lakewood Community Preschool, and the Whitted School to create food pantries in those preschools so that the families can come and get food when they're dropping off or picking up their children. And we've worked with the 3 Durham's farmers markets to support and expand the Double Bucks program. And Double Bucks is when people on SNAP, WIC, or if they live in public housing, they can go and their money is doubled at the farmers markets in Durham. South Durham Farmers Market, Durham Farmers Market, and then the new Farmers Market located at Seeds, run by Communities in Partnership, are the 3 markets that participate. Finally, we worked, thanks to the commissioners and the support from the county. Durham County has a new food security coordinator position, which should be filled reasonably soon. The goal is to increase food security and build a stronger, more resilient food system, and it will be housed in the cooperative extension. So that is what we have done since April. Does anyone have any questions?
Yeah, thank you, Kelly, for that. That was really great information. There is quite a bit going on out there in the area of food insecurities. Just one question: the 6,533 children that you said were receiving food, the school children, is that number capped there because of the availability of what we have to give them, or are the other folk just aren't aware and aren't coming?
They just aren't coming. That's correct. And not all those people are food insecure. Durham Public Schools needs to keep that number at about 7,000 in order to pay their staff. So there's been a big push among all Durham Public Schools families to pick up that food, and any child can get it for free, whether they are a public school student or not. So I actually pick it up for my children just to help those staff stay employed. And I'm not food insecure. So there definitely are a lot of people who just aren't going to get that food.
Right.
Hey, Kelly, thank you so much for this presentation. I was wondering, for nonprofits and other organizations that are here in Durham, what would be the best way for them to get information on how to partner with Durham County? Because I know that there's one group, for example, that has tomorrow and next Friday, they're distributing like 100,000 pounds of fresh produce in Durham County. And they're looking for like individual ways to partner to distribute that equitably across Durham.
Yeah, so they definitely can, anyone can become part of that task force. We have meetings every other Wednesday. And if you want to email me, it's just kwarnock@dconc.gov. I can connect them. And we email each other, and we have, they can come to the meetings or they can just get onto our listserv.
Perfect, thank you.
Yeah.
Any other questions for Kelly? Thank you, Kelly. Outstanding job.
It's good to see you again, Eric.
All righty, you too. Always a pleasure. Item number 7 on the agenda is where staff can respond to any questions you might have regarding the public health vacancy report, the NOV report, and the health director's report. We'll start with the public health vacancy report. Any questions for staff from the board?
Yeah, I have one question in the vacancy report. That number of 20 resignations through December, of course, is quite high. So, which makes it to me more amazing that the staff is still able to function the way that they are, and you're still able to get the job done. So can you speak on that just a little bit, Rod? Like the reasons, we can guess, I guess, what the reasons are that people were, were needing to leave, but how are we able to sort of fill that void and keep going?
We have been incredibly blessed to be able to keep the show on the road. As you know, being in healthcare, Dr. Jackson, be it Lincoln or Duke or whoever, this is sort of like the tide that we're facing right now in terms of people really getting COVID fatigue and really just kind of taking into stock their personal situations, be it childcare or just being, one to really venture out to say, the grass may be greener on the other side. So with that being said, we have been truly, truly fortunate to have the county manager who really works with us. We are on a hiring freeze to the members of the board. However, on a case-by-case basis, we can request for that freeze to be lifted. And there have been very, very few positions that I have requested to be unfrozen that the county manager has declined. So to that regard, we've been able to, take the resignations, but then also fill the positions. relatively quickly. So, you know, we're very fortunate. But to answer your question, you know, there've been many who've just kind of said, you know, I have childcare issues and I have another job that works for my situation. Or there have been some who've been shown the door for various reasons. And then, of course, there are just some that just say, you know, hey, I just want to do something else.
Very good. Thank you. Any other questions regarding the public health vacancy report?
Yes, I have one. This is building off of Dr. Jackson's question. Dr. Jenkins, with the schools reopening, how are we going to address, I see that there's several school nurse positions that are vacant. How is that going to impact our school reopening process? And what are the roles of the nurses that we do currently have as the students and teachers begin to return?
Thank you for that question, Commissioner Alum. It is going to impact us tremendously. The school health nurses have been the backbone of our surveillance efforts. And we're fortunate in that through our partnership with the state, that we have been able to really ramp up a lot of personnel for surveillance. And of course, surveillance is contact tracing, contact investigation, and also providing leadership with that. As you may recall, for those of you who've been on the board for a while, when we first started off, it was just us. And we've been able to get some anywhere from 95 to 115 people to really encompass our total contact tracing, investigation, surveillance staff. At present, the school health nurses are very instrumental in our hotline number, manning our hotline. They're helping us in our vaccination clinics. And they're just there's several that are still serving as leads for our surveillance. We are constantly working with our director of nursing, director of nursing Hattie Wood, to make sure that we can use these COVID funds that we've received in order to be able to get some temporary help. And I commend Hattie and Cheryl Scott for pushing that through. The temp nurses that we have now working in the vaccination clinic are fantastic. I'm certainly hoping that we can get some more to fill in the gap, so to speak, when they do have to go back. But yes, we are certainly concerned. We know that it's right around the corner, and that's going to create a vacancy. We also know that our school health nurses play a pivotal role in the schools. You know, they make sure that they provide the care. We have had some difficulty, to be very transparent, in filling some of those positions, but we've also had some luck as well. As you would imagine, some nurses are a little hesitant or reluctant to go into schools because of the fact that they weren't vaccinated. But of course, you know, with the announcement yesterday and our plans that are currently in place to vaccinate DPS, to include charter schools, private schools, I think that should change in the near future. I hope that answers your question.
Thank you, Rod.
Mm-hmm.
I had a real quick question for you. The number of retirements that took place, how negatively did that impact your budget? Or did it impact it at all? Because I know you had to pay for benefits and things like that.
Not much of an impact. I think off the top of my head, we may have had, through the course of the pandemic, Mr. Chair, maybe 3 retirements. Mm-hmm. We got one pending within the next few weeks. Not much of an impact. So proud of our fiscal management staff, finance staff. They've done a really good job balancing lots of monies that we've received. Proud to report to the Board of Health that we've not necessarily had to ask the county for hardly anything because of the funds that we've been able to receive. We do know that there are more monies coming, and we are so delighted that House Bill 61, I believe it is geared toward communicable diseases. And this is the season for public health, make no mistake about it. They are capitalizing. We have a lot of lobbyists really going to the General Assembly and speaking on behalf of public health whose budgets have been flat for a long, long time. And now we're starting to see, we're starting to see that, people recognize the value of public health, be it a pandemic that's causing this recognition or what, but, we're fortunate for that.
Thank you, sir. Next, any questions with regard to the public health NOV report?
I'll just update the board a little bit. I'd like to thank the environmental health staff. They have been really putting a push on to get some of these NOVs resolved. I think we had 3 or 4 resolved since the last meeting, which is actually a very high number. Mm-hmm. And so they are really doing a great job. And, we just sort of, case by case going through them and resolving them as best we can. But, it's a difficult situation, particularly now during COVID, when there is a moratorium on any kind of eviction or any kind of process that would remove someone from their home. Exactly. We still have to enforce the environmental health laws, but it just makes it a little bit more difficult. And then the practical matter is, the docket at the courthouse is really reserved for cases that are, of extreme importance. The social services cases, criminal cases. And so there are many civil cases that are pushing forward, but in terms of prioritizing which cases to sort of push forward at this time, I don't think injunctive relief for environmental health violations, unless they are extremely egregious, are going to be, received very well by the judges. So environmental health is working. They're really working, and they're doing a great job. And we're getting them resolved one by one.
Thank you, Brian. And Chris, thank your staff on behalf of the board for the outstanding work you're doing. We appreciate it.
Yes, sir. I will.
Thank you.
Wait a minute. Who was that? That couldn't have been Chris Salton.
You need to stop by and see me more often, Brian.
Looking good, man. Looking good.
Thank you, Chris.
I look as old as Eric now.
Oh, Health Director's report. Any questions with regard to the Health Director's report? Hearing none, we'll move on to committee reports. Finance Committee. And from my understanding, Finance Committee hasn't met. I think what they're in need of is an idea or understanding of when Roger and your staff would like to present the proposed budget to the board for consideration and approval. And I'm not sure what the county's timeline for budget prep might be.
We are putting the finishing touches internally on the budget, proposed budget, I should say. As you would imagine, it took a little bit of time, primarily because the county did want to really host a number of different meetings, given the current state of economic affairs that we're in right now. I do know that Will is on the line, and welcome his input, but I know that it shouldn't be too much longer before we'll contact the Finance Committee for presentation to them. Will, anything else you'd like to add?
I can't think of anything, but I think the approval of the board can work somewhat independent of my deadlines and when I have to actually submit it, because I know that even after I hit the submit button to send it to the budget department, there will be a few changes that comes after that. But for the most part, as soon as the Finance Committee can agree on a certain time, I'll be ready to rock and roll.
Very good. Will you have enough for us to maybe consider at the April meeting?
Absolutely.
Yeah, we'll make sure that the board is able to receive our proposed budget, because of course we know that it has to be approved by this board prior to being submitted to the county commissioners.
Right. And the way we've done it in the past, Roz reminded me with the finance committee, the finance committee is appointed, but we actually meet during the regular meeting. So we'll only have to present it one time. And it'll be to the finance committee with the full board.
Absolutely. We'll make sure we get that done.
Very good. Thank you. Thank you. Old business. Vaccination discussion around COVID-19 and meningitis requirements for DPS. Rod?
Mr. Chair, I'll be very brief. Nations have been going extremely well. We did, again, as this board well knows, we did receive our first shipment of Moderna on December the 21st. And, after, I think it's safe to say for the entire state, after a fairly rough start, we've smoothened out our processes, and we have been successful in being able to receive shipments of vaccine ever since. A lot of our time, ladies and gentlemen, has been spent toward community outreach in the form of homeowners associations, church events, civic events, really trying to speak toward the vaccine and to really dispel a lot of vaccine hesitancy in communities of color. I will also report that as of Monday, we have really been at it as far as exhausting all of our doses. That is a requirement that we receive. On Thursdays, we receive notification of how much vaccine we receive. There is a survey that has to be filled out indicating whether or not you're going to use all of your vaccine or whether or not you're going to use some of it, and you have to give reasons why. And then, of course, you submit that in anticipation of receiving it. On Tuesdays, we receive our shipment of first doses. And then, of course, I think toward late Thursday, really maybe Friday, we receive our shipment of second doses. We're in a nice rhythm now. So again, we know there was a lot of uncertainty at first, but right now we know when we'll get it. So it allows us to plan. We do, or I should say did, have a very, very large wait list, as you would imagine. And then we did have some difficulties as far as a wait line, as far as scheduling and everything, but all of those things have been resolved. We do still have a wait list. We did have our hotline, our scheduling line, I should say, on pause. We still have that on pause, but nevertheless, it's been a little challenging because this is a vaccine without borders. And if it was confined strictly to Durham County, we would have a lot more, we wouldn't have much of an issue. But again, we've had people as far as Virginia, South Carolina. There's some counties that had people from Los Angeles, California, to really come in while they're here for business. They get the vaccine, they reroute their flights in order to be able to get the second dose. So it's been challenging to say the least. We have exhausted 87% of our Moderna. And of course, that's the vaccine that we received first. And then about 60% of our Pfizer, we received that several weeks later. And this, again, we're able to really take care of our residents. In terms of our current allocation, we only receive a guaranteed allocation of 600 doses that's guaranteed through next week. And then, of course, we have received what they call equity doses, and that's to target our Black and brown population in Durham and also our seniors 65 years of age and older. And we have done just that. I think we don't know what is on the horizon. As of yesterday, I take that back. As of Tuesday, They were saying that we would have another 3-week iteration to where we would know what our guaranteed dosages were, and then we would also know what our equity doses are. I don't know that whether or not that's still in play because of the news that came yesterday from the governor, really wanting teachers and all staff for public schools, really all schools, to be vaccinated as we move into phase 3. He wants them to be the first group. Local health directors are in a bit of flux right now because we don't know where the vaccine is going to come from in order to accomplish this, to be very transparent. You would imagine 1,300 doses is not going to do it for a school system in Durham that has in excess of 5,200 individuals total. And then that's also, you also have to take into consideration private schools, charter schools, and daycares, which we know is a very, very exhaustive list. In total, we're talking anywhere from 12,000 to 13,000 people total. And that's just a rough estimate. So the task before us is very, 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 very daunting. We do plan to work in concert with Duke, and there's a 12 o'clock conference call to discuss the way forward with this new directive from the governor on tomorrow. I have no doubt that we'll come up with a very good plan, solid plan to make it happen. But rest assured, as we've been saying all along to our residents, it will take a while when we will ask them to continue to be patient. Back to the wait list, just so proud of our scheduling team under the leadership of Lindsay Bickers-Bach, our head health education community transformation director. She has, her and her team have whittled down our wait list from in excess of 11,000 to right at about 3,000. And that's attributed to the fact that people are, in the words of the old Motown song, they're shopping around. So they're trying their best to make sure that they go wherever they can to get this vaccine. Unfortunately, they are not necessarily calling us back to let us know that they no longer need their appointment. So we're doing the very best we can. The last thing I'll report to the board as it relates to vaccine is the fact that Durham is doing extremely well when it comes to our utilization rates, i.e. those people who are actually getting the vaccine. We're doing extremely well above the state average, percentage average with Asians, Blacks, and Latinx. And by numbers, first doses, Durham County is doing 5.8% for Asian, 21.92% for Blacks, 3.9% for Latinx. And we know we have a lot of work to do in those categories, and we're lagging behind in the white population being vaccinated at 67.24%. Finally, I will say, Mr. Chair and others, I have taken residents in the vaccination clinic, and it's for the purpose of making sure that staff knows that I'm there if they need to make a, quick decision or they need some assistance. I have directed traffic a little bit, but they normally tell me to go back to my table and sit down. But I will say it's been a pleasure to see the residents come in, from 99-year-old individuals to those who are most frail, most vulnerable, special needs population to come in and get their vaccination. And it's what healthcare is all about. I cannot sing enough praises of my staff, particularly the nurses, the vaccinators who've given extra TLC to each and every one that sits down to get their vaccine. I'll be more than happy to answer any questions you may have.
No questions for Rod?
I have some questions. I have a couple of questions, Rod.
Sure.
So my first one was what has the fall off rate been on a daily basis from like people scheduling to being no-shows? Has that?
If I could, I guess, quantify it, first, Commissioner Lum and members of the board, the staff has heeded the clarion call that I've given them. I've said, I don't want us to waste any vaccine, none. And I think since December 21st, we may have actually wasted 3 doses. And that's primarily because there's some complication. There were complications with the needles or whatever have you, and kind of got thrown out, but it's to be expected. We've been fortunate enough to be able to tap into our wait list for when, say for instance, we have thought out the vaccine, Commissioner Lum, and there's people who, definitely need to get vaccinated. We have been following the state's guidelines, which is not to waste any vaccines. So of course, DSS is right around the corner. So if in fact, they are up for the vaccine, we've been reaching out to them. We've been trying our best to to use our wait list for that. So to that regard, we are starting to see some no-shows. It could be anywhere from 10 no-shows to 20 no-shows. But we have been very creative. Definitely want to give praises to Deputy Director Kirsten Patterson and Nurse Supervisor Malkia Kiki Rayner for really, really keeping their nose to the grindstone and making sure that we don't waste any vaccine.
Thank you. And I had a few more, if that's okay.
Sure.
Is there any possibility for Durham County? I saw that Wake County is doing their max vaccination site at PNC. They've partnered directly with a lab to do that vaccination. Is there any possibility for Durham to be able to do that?
It's complicated, and I'll do my best to make it plain. We did start off with the news that there was going to be a state-sponsored mass vaccination site. For all intents and purposes, Fidelity and the State Office of Emergency Management and Duke had reached some type of agreement in principle. And vaccine was steered away to huge events in Charlotte, and also 2 huge events in Charlotte, and there was a huge event in Forsyth County. And as a result of pressure from the CDC, we had the empty shelf experience to where every health department had to empty their shelf. And I think that also extended to hospitals as well. So we did all of that only to exhaust the supply, to really show the CDC that we could. And I think we went from number 36 in the country to number 6, from what I'm told. With that being said, now there's this huge shortage of vaccine. And, full transparency, there have been some manufacturing issues with Moderna and Pfizer, with them keeping up with their commitment to provide 100 million doses. All of that being said, we now have a severe vaccine, which has paused a number of things. It's paused the mega site, which had the ability to do 17,500 vaccinations a week. It's also paused a much smaller site, which would be the OptumServe, which is our current COVID-19 provider, but also they were going to do vaccines as well. I'm proud to report that the Optum contract is probably going to be signed within the next day or two, and they're going to come online to be able to help right on time, because we got all these teachers and daycare workers. We need to do that. So we've looked at the Durham Stadium. Unfortunately, we can't do that because there's thoroughfare issues in terms of, kind of direct. We are also exploring a number of different things, from Sears at South Point Mall to, we've looked at Northgate, but there's a huge Amazon presence there. I say all that just to say, Commissioner Lum and members of the board, that there's not too many options in Durham for a huge site. We've gotten a number of different requests from a number of different places. In our partnership with local emergency management, we explore all of them. And unfortunately, we don't have like a high throughput area like a PNC arena to do it. Nevertheless, we are working hard. Again, our southern site is being stood up. Duke is doing a lot of pop-up sites. And as far as us here at Local Public Health, we had plans to start on Saturday to where we would do churches, we would do Latinx pharmacies. We have a lot of different sites. And of course, you have to request, if it's going to be anywhere from 500 and above doses needed, you have to request it from the state, extra doses, and it's not guaranteed. So again, I'm still proud of what we're doing because, as mentioned, our utilization rate is tops in the state. We're doing a very good job. Some people in the community might feel as if we're not doing enough, but when I say that it's because we don't have vaccine, it's just telling the truth.
Thank you, sir.
I think
go
you might
ahead,
have
ma'am.
another question, Mr. Chair.
I'm
I
sorry.
have two more, and then I promise I'm
Okay.
done. So as we hopefully, like I saw Biden's announced that he's able to secure 200 million doses. So hopefully that will increase some of the doses that Durham County is getting. Are we going to be pulling for scheduling future appointments? I know there's been a pause. Are we going to be pulling people from the wait list who are eligible, or do individuals who are on the wait list have to schedule a new appointment or fill out the form?
We will pull from the wait list, and we have been pulling, Commissioner Lum and members of the board. We still have our great partnership with Southern High School, and that's a Duke partnership, to where we schedule. And that's the reason why we were able to pivot and not have to cancel any appointments. We just simply rerouted those appointments to Southern. And right now we have the capability of scheduling 360 appointments per day. And we fully expect that that probably will increase as their ability to increase the throughput gets better. So with that being said, I also failed to mention that there's a partnership with Walgreens, to where Walgreens is going to start providing vaccine. There's 11 Walgreens sites. So at first they're going to start off with 100 per week. That's 1,100 vaccinations in Durham County. So we know it's only going to increase. I have a sneaky suspicion that when the Biden administration does secure those, then that's when it's going to be mandated for a lot more pharmacies, a lot more, primary care practices to be able to do it. Because as I've been saying to you for a while, that's the only way that we're going to really penetrate the masses. Folks are not going to just wait on, sit around on wait lists. That's the reason why we're just having such a quandary with going back and forth with the different wait lists. People are just shopping around. So I think that I think they will be successful in securing those doses. Everything that President Biden is wanting to do, we're doing, as far as getting kids back to school. That's the governor's order from, just really flooding the market, with vaccine. To be determined about the Johnson & Johnson product. I mean, we're still seeking guidance as to how to best administer that. There may be some reluctance with that. I don't see why, because a month and a half to 2 months ago, if you presented Johnson & Johnson with just 70%, people would have been jumping up and down, sign me up. But nevertheless, we shall see what happens. You got one last question.
Yes, the last one is, what can the board, our board of commissioners do to support these efforts? I know you've been coming and giving us presentations, but as the representative of this board, how can we be supportive to make sure that you have everything you need?
Thank you for that question. I will say the Board of Commissioners has been wonderful in terms of, receiving my briefings and really providing assistance. It's that continuing advocating for more vaccine for Durham. We have the structure in place. It's been operationalized, it's been hardwired, it's received rave reviews. There's not a time that I'm in the vaccination clinic that somebody doesn't come up and say, you guys got a real smooth operation, it flows really nice, this is great. We know that we can do upwards of 700 to 750 vaccinations a day. We know we can. With our partnership with Duke at the Southern High School site, even if school goes back into session, we will have a way to be able to have a place and a space to vaccinate.
So Rod, I just wanted to let you know, I volunteered last week at the Southern site, and it was just so well appreciated by that community. And every single dose was used, and it was really just wonderful. I just wanted to get that in there.
Thank you so much, Sorto. But like I said, I mean, it's here. We just need vaccine. I mean, I know I ended by saying that every time. We just need vaccine. If we get vaccine, I have staff that are chomping at the bit to do a lot more community service. I mean, we feel kind of bottled up here because our charge is to go out toward the masses. So I would just say, Commissioner Lum, I know, the power of the pen when you guys have, like when you do proclamations and you do all this other stuff. I mean, please, by all means, if that's something you can do, we would greatly appreciate it because we just want to vaccinate and get things back to normal.
Thank you. Anyone else? Meningitis requirements for DPS, real quick, Rob.
I will punt this one to our Director of Nursing, Hattie Wood, who will provide you with this update.
Good evening to the board. Can everybody hear me?
Yes, ma'am.
Okay, thank you. Okay, so the school health nurses, they follow the same process every year for checking the immunization records, and they do it every year at the beginning of the school year. And there's a data manager at the school system that they work with, and they get a list of all the students who are entering kindergarten or first grade, 7th grade, and for this year, the 12th grade also. They take that list of names and they go into the NCIR, which is the North Carolina Immunization Record, to determine which vaccines are needed by these students, if they need any per the state requirements. Then they recheck that list again for the first 30 days that school is open, sharing that list with the person that's designated at the school, the data manager, and others who are designated to work on this project and monitor the compliance rates. The students identified as needing this vaccine, they receive reminders from the school, staff, and teachers. There are reminder letters that we have in English and Spanish that they give out to their that are sent to the parents. They get robocalls that are made specific for grades 1, 7, and 12 about the immunizations that are required for each of these grade settings. And every effort is made to ensure 100% compliance with the state immunization laws. The nurses work collaboratively with the school, but ultimately it's the responsibility of the school to ensure the compliance because it's a school law. So we check records this year in the elementary, middle, high, and high school. This year we checked 2,250 elementary records. We checked 1,402 middle school records and 1,900 high school records. The school nurses provide a wealth of information to the schools, including the memos sent from the state about the new laws and the vaccine requirements. They also provide templates for the reminder letters for them to send to the school, for the school to send to the parents about who are delinquent and which required letters and that can be, which required vaccinations are required for them. And this information that can be posted on the school website. Again, it circles back to the responsibility of the school to review and distribute this information. Some schools focus on getting 100% compliance, and they strive for that every year. Other schools are not as focused on this issue at all. The degree of involvement of the principal in this issue affects the vaccine compliance rate of the school. And there's a couple of letters that we have them in English and in Spanish. We send one letter. We give them the first letter that the principals can say to the send to the families that are out of compliance about, you have so many days to come within compliance that your child is not in compliance for a specific vaccine. And this year, Dr. Braitworth, I know you were concerned about the meningitis vaccine for the 12th graders, that it's required they get a booster. And so that was added to the letter also for the 12th graders, for the parents of the ones that were in non-compliance for that. And the letter, and then there's a second letter that says, you have within a certain length of time that you've got to get your child vaccinated, or they are not allowed to come into the school. There are exemptions, I'm sure, which we're all aware that if there's a religious exemption, and what the letter will say, that they can have, they can say that they're exempted from it based on specific criteria, religious exemptions and others. But this is what we do every year. And Mr. Summers is our DPS contact. He was at the time for this past year. And that we had a meeting with him well in advance of the new requirements for the 12th grade boosters for meningitis. And we also have the letters that we give to the schools for the income, since we checked the high school records this year to see who had had their booster and who had not. To take into consideration, I'm just going to say that school's been out, but we still did check the records. Our school nurses went into the school system and checked the records to see who was and who was not in compliance with this. Are there any questions?
No, you actually answered my question when you said that you all continued to check even during the pandemic when they weren't in school.
Yes.
Because at Lincoln, our numbers are down in well child visits and kids coming in and getting immunizations. So that's why I was.
Go ahead. I'm sorry, Dr. Jackson.
No, that's just why I was especially interested to hear about that.
And so our letter, the letter that the parents get, also states where, in addition to their PCP or their pediatrician, that the Durham County Department of Public Health can provide the immunization as well. And we have on there, just call and get an appointment, and we can give them the immunization also.
Okay. Yeah, well, they're not coming into Lincoln because they're just still afraid. There's some moms that are still afraid to bring the kids in.
Yeah,
but
and
I guess now they actually are going to be going back to school.
Yeah, and we are open. Our immunization clinic is open. Our clinical services have been cut back some, but not all. I mean, so we're open 3 days a week, and we provide vaccinations, and we can, you can get appointments for that. So,
That's what. Thank you for that. That's great to hear. Are there any concerns that you have looking at your data?
not at this point, Dr. Braitworth. What we'll do is when we go back and look at, once school opens back up, we'll continue to look at the records, because this is what they did before this, when the summer before school started, we looked at what the rates were and what the students that had not had the vaccinations. We'll go back in once everybody's back in school, and the nurses go back in, and we pull our school nurses back in, back into the school system and look at the records again. And if need be, they will get that letters. The parents will get the letters from us saying that they have to be immunized, and they're given a certain length of time. So all of this is going to be put on a different timeline based on the fact as to when school is going to be going back in. But they will be given that 30 days. And so they have to comply within that time. And it's up to the principal, actually, like I said, in the school system to assure of the compliance for this according to the law.
That makes sense. Thank you. I'm just hopeful that we don't see the emergence of other diseases as a result of some missed physicals. So I'm glad you're taking more than one look at it. Thank you.
Any other questions?
Thank you, Annie. Thank you, Rod. Next item, new business. We have 3 budget amendments that we need to review and approve, and we'll take them one at a time. Rod or Will,
yes,
do
sir.
y'all take us through these budget amendments?
More than happy to, sir.
Thank you.
First amendment is, believe it's to recognize $877,282 from the North Carolina Department of Health and Human Services for epidemiology and communicable disease. Ladies and gentlemen, this is just additional funds for us to continue our COVID work. If you recall, this is simply the monies that we had really been promised to be able to do the work that we do, to include testing, to include hiring temp staff, to support our surveillance work. So that's pretty much all of that really required. The second budget amendment is for $48,935. This is from the Division of Social Services, and it is for the support of our DINE program. And again, it goes to support all of the work, the great work, I should say, that they do as far as program implementation. And finally, budget amendment for $125,000 is for the jail medical care. As you all well know, public health manages the contract for jail health medical services. The funds are to be used to pay for healthcare costs, which exceeds the capitated amount which is 400,000. Anything over 400,000 requires that budget amendment. Chair, that concludes all the budget amendments.
Thank you. Question, Brian, do we need to vote on these individually to approve them? Or can we vote on the three as a whole?
You can do all three at one time.
Very good. Thank you.
I move to approve all three budget ordinance amendments.
And so second,
It's been moved and properly seconded to approve these three budgetary amendments. All in favor by roll call vote?
Mr. Allen,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
yes,
Dr. Braithwaite,
Yes.
Ms. Orto,
Yes.
Mr. Brown,
Yes.
and Commissioner Alam.
Yes.
Thank you.
Thank you. Next is the fiscal year 2021 sliding fee scale approval. Rod or Will?
I will defer to Will on this one.
Good afternoon, board. As far as the sliding fee scale, I'm not sure that the new board members are aware, but each year on February 1st, the new sliding fee scale is released. And as a public health organization, we are required to use that particular sliding fee scale. And the board has historically approved that before it's put into use. And I'm not sure how much detail you want me to go into it, but it's based on the family size. So if you have a family size of one person or two persons, you can look at the sliding fee scale to see where that particular family size would fall on that scale to determine how much of their costs for providing services would be slid to a certain percent of funding. And so it's based on the ability to pay.
Thank you, sir. Any questions? Chair will entertain a motion to approve the sliding fee schedule.
I move
so
approval.
moved.
Is there a second?
Second.
Thank you. It's been moved and properly seconded to approve the sliding fee schedule for 2021. All those in favor of approval by roll call vote, please.
Mr. Allen,
Yes, ma'am.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes,
Dr. Braithwaite,
Yes.
Mrs. Orto,
Yes.
Mr. Brown,
Yes.
and Commissioner Alam.
Yes.
Thank you.
Thank you, everybody. The next is agenda items for our April 2021 meeting. If we're going to do budget, that I would think that meeting would be strictly for budget presentation and approval. Or do you think our agenda would be able to entertain other items?
No, I think that will likely
Okay,
take a big chunk of time.
very good. So Rod, you and Will think we'll be ready to go on the April meeting with the budget presentation?
Most certainly will, Mr. Chair.
Very good. So we'll look at that being the only agenda item for our April 2021 meeting, if that's okay with the board. I'm gonna assume silence is golden.
Yeah.
Very
Like my
good.
mama says, silence gives consent.
There you go. Thank you. Next, item number 11 is informal discussion. I'd like to ask Rod a question, and you may or may not know, is Duke or anyone following previously hospitalized COVID patients with regard to continuing adverse conditions relative to having dealt with it? Do you know? Or is anyone planning to do that, to follow up with them to see what the status of those adverse conditions are? If they need any additional support relative to them?
I will say, Mr. Chair, that I don't know, but I definitely could find out for the board and report back. I would be highly surprised if they weren't, given that this is such a renowned research hospital. But I'll be more than happy to put some feelers out and obtain that information for you, Mr. Chair.
Yeah, please, if you would, that would be great. And one other thing, what was it? Can you provide us, I guess it would be our June meeting, given that vaccinations will still be going strong and your workload will still be heavy. At the June meeting, can you give us an update on COVID variants that we need to be vigilant for?
More than happy to, Mr. Chair.
Very good. That's all I have for the next meeting. Any other informal discussion?
Yeah, I just have one quick question about the jail. So are we vaccinating any detainees at all? If they fall into a group, like if they're folk and they're 65 and older, are we?
We are not, we have not begun vaccinating them yet, Madam Vice Chair. I will say we look forward to it. And for the most part, we have worked it out to where WellPath is an eligible provider. And the only thing we would have to do is provide them with the vaccine, and they're the medical provider for the jail, and they will be able to do it themselves.
Okay. Okay, so no staff has been vaccinated either then?
At the jail?
Right.
We have taken care of, we've taken care of about
the medical staff?
About 75% of the staff.
Okay.
Very good.
Right,
anything else? At this time, the chair will entertain a motion to adjourn.
So moved.
Second.
Been moved and properly second to approve adjournment of the meeting. Roll call vote.
Mr. Allen,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Mrs. Orto,
Yes.
Mr. Brown,
Yes.
and Commissioner Alam.
Yes.
Thank you, everyone. We are adjourned.
All
We'll
right.
see
Thank you.
in
Good job,
April.
Eric. Your first meeting.
Thank you.
And Happy New Year, everybody, because I don't think we've seen each other.
Happy New Year's.
It is
Happy New
February,
Year.
but I haven't seen you all. So Happy New Year.
It's great
Good day,
meeting you
everyone.
all.
We're all
Bye.
looking forward to much better year this year.
Yes.
Oh, yes.
Thank
Right.
goodness.
Absolutely.
Y'all take care.
Everybody stay
Bye.
safe.
Bye.